topic.
Okay.
And she's with the Oklahoma Hospital Association.
Oh, okay. I guess I'm not met her
I
before.
haven't either.
Topic.
Uh-huh.
What's she do there?
She's their nurse, she said.
Oh, they're great.
Yep.
And then
So we can
is
recognize
Greg
one more.
with, you know what Greg's
I know what Greg
position?
looks like. I know what Greg looks like. I think he's their communications director.
Hi, Steve
Yeah.
Bufford.
In my topic,
Nice to meet you. I guess we never met. You know, I was on the board of the Hospital Association for a little while.
yeah, I recognize your name.
Yeah, I've been around. Been usually if you're around Oklahoma enough, you'll see my name occasionally.
Sure, yeah.
So are you? You're an RN?
Yes.
Wonderful. And what do you head up
So
over there?
I'm the Vice President of Clinical Excellence, so quality, safety, infection prevention, and workforce.
So, just a little bug in your ear. You know, Willingham,
Yes,
your
Kelly.
colleague, and I don't know, there was somebody else, Sean. There's another person at your organization that's working on the TSET Legacy brand.
Yes, that would be Eric.
Eric.
Yes.
Yes. So we may be coming in, the group that I'm with, not the Lions for Healthy Families, but here at OU to assist with that. I don't know if you've heard about
I
that.
have, yes.
Okay.
That's for the
Lung cancer
partnership with lung
screening.
cancer screening.
Right. That's what we are proposing to be an add-on to what you all are already proposing to add a kind of a reach out to all the primary care practices associated with the practice or with the system, as it were, that you all are doing with the hospital setting. So, yeah, so we're excited about that, and hopefully the machinations at the state capitol now. I don't know if you know where they send the machinations go. Just heard about them last night.
I think it'll be a little difficult for them to do what they're wanting
Yeah.
to do.
Yeah,
to
let's
dip
hope.
into those events.
Well, without a state question, they're going to play the Trump game, where they just declare it and then make the assume. That's the new system. That's the new system of the world. So, oh, stop! I was telling my colleagues over there, I'm probably one of the few in this crowd that actually had the measles when I was 4 years old.
My mom had it as well.
Is that right?
She did.
The thing, ask your mom, the thing that I remember distinctly was when we were
So it make you blind or
yeah,
something.
make you blind. Well, it was all because you got a conjunctivitis with it, and there was a worry that you watched too much TV and focused.
She said sunlight and TV. So she remembered like sitting in a room,
Dark room.
with no TV or something. So she remembers that very well.
I just thought it was, and I still remember, almost to the minute the day I got sick. On that day, I was standing out in front with a bunch of other kids in the front lawn, and everybody was talking about me. I guess I better go in.
I think I have the measles.
Because everyone else, I lived on this little cul-de-sac, and everyone was getting it. So it was, crazy spread and all of that. Thank God, none that I know of had any significant health consequence from it. We were all relatively healthy. Of course, somebody calls me. Let me tell them I will call them later. I think he's anxious because I have Thunder tickets and I sent them to him and he probably can't find them. Yeah, because he's going to Yeah, let me see. What picture did he share? Yes, Emily, the one, yeah, you know Emily. I'm taking elections for Emily, so I guess we'll
It's fine.
we need.
We'll put Julie in the middle.
You want to borrow my key too?
Yeah, that's okay. Oh, no, she doesn't. See you in person. I remember back in COVID, we got to do things together. Well, thank you for being here.
Of course.
So what are we doing? Are we doing 3D hand? Are we doing?
Are we taking a?
Doing the same thing.
You want to get a mug shot? Let's turn sideways a little. Show my better figure.
Oh, I see.
You're good.
Okay.
Act like we like each other.
That's a good idea.
Are we ready?
I'm ready. Yes, yeah, they want everybody to stay.
Great.
All right. Well, good afternoon. On behalf of the Oklahoma, I can talk, Alliance for Healthy Families, I want to thank you for joining us today. I'm Dr. Steve Crawford, Chair of the Oklahoma Alliance for Healthy Families. In addition to Oklahoma Children's Hospital, OU Health, and the Oklahoma State Medical Association, we are pleased to have the support of the Oklahoma Academy of Family Physicians, the American Academy of Pediatrics Oklahoma Chapter, Tulsa Area Immunization Coalition, Oklahoma Nurses Association, Oklahoma County Medical Society, the Oklahoma Institute for Child Advocacy, the Interfaith Alliance of Oklahoma, Oklahoma Caring Foundation, the Oklahoma Osteopathic Association, the Oklahoma Dental Association, and the Oklahoma Hospital Association. We also have in our audience today representatives from the Oklahoma Academy of Family Physicians, Dr. Rachel Franklin, President-elect, Greg Sawyer, the Oklahoma Institute for Child Advocacy, Dr. Sherry Baker with the Oklahoma State Medical Association, and Emily Kopic from the Oklahoma Hospital Association. Thank you all for being here today. All of these groups have come together to support children and families amidst a dangerous national outbreak of measles, a disease that was previously considered nearly eradicated but has made a comeback due to falling immunization rates across the country. In Oklahoma, immunization rates have fallen to critical levels each year. The Oklahoma Health Department conducts a survey in partnership with the State Department of Education. The most recent study conducted for the 23-24 school year found that exemption rates, those choosing to opt their children out of life-saving immunizations, have reached an all-time high, with a 5.6% exemption rate for public school children and 8.8% for private schools. We know that for a disease like measles, at least 95% of a community needs to be fully immunized, but that's not happening anywhere in Oklahoma. Immunization rates vary widely by county, with some counties coming in at an immunization rate of only 77%. These numbers represent giant, flashing alarms, and we are pleased to see that the State Health Department sound the alarm with their May 1st memo providing guidance to schools. The memo suggests that schools proactively reach out to parents, particularly the parents of children with a vaccine exemption on file, and stress to them the importance of all recommended immunizations amidst the current measles outbreak. We know that's asking a lot for our schools. These are difficult conversations, but they are vital ones. To help schools provide information for parents, the Oklahoma Alliance for Healthy Families, in partnership with OU Children's OU Health, the Oklahoma State Medical Association, and other partners, have created a toolkit for schools to implement the health department's recommendations. You can see that toolkit on the screen. The toolkit includes a digital flyer that can be posted online, printed, or sent as an email attachment for parents. It also includes suggested language for parent outreach, as well as social media toolkit with science-based information about measles and the role immunizations play in protecting children and their entire families. The toolkit is available online at the link that we'll give you in another slide and is being shared by our partner organizations. This is a vital effort. With more than 1,000 cases of measles and several measles-related deaths already confirmed this year, a further widespread outbreak will likely occur unless we take action now. So we're urging parents to do what they should do to protect their children, their families, and their neighbors. Here to talk more about the current outbreak and the long and short-term effects of measles is Dr. Donna Tayungu, one of our fabulous pediatric infectious disease specialists at OU Children's Health. Dr. Tayungu, please join me.
Thank you so much, Dr. Crawford. I'm going to talk initially about kind of the history that we've come through with measles. Previously, before vaccinations, we had many, many cases, 200 to 600,000 of measles cases annually. We did a great job with vaccination campaigns, and in 1978, a measles elimination program was initiated, and by 1990, we had over 90% of measles cases being linked to international travel because the cases had dropped so much. Currently, we have in Oklahoma 17 measles cases this year. In the United States, like was previously mentioned, we have over 1,024 measles cases across 31 jurisdictions. In the state of Texas, we are, as of today, up to 722 cases. 96% of infected individuals are completely unvaccinated or have an unknown vaccination status. And the rate of hospitalization right now is around 13% of cases. As was previously mentioned, we have 3 deaths, which are just unheard of in this day and age because vaccination has completely eliminated that. And previously to this year, the last healthy child that died of measles in the United States was around 22 years ago. So as of May 20th, we have 17 cases in the state of Oklahoma, and then in the state of Texas, 722 cases. Of those cases in Texas, 93 children have been hospitalized. In New Mexico, directly linked to the Texas outbreak in Lee County, they had the vast majority of their cases, and that is totaled at 74 total cases. Unfortunately, in Oklahoma, with the level of vaccination in our kindergarten age population, we are ripe for more cases in our state. The long-term impact of measles is really important to discuss. So there is, I think, among families, this notion that measles is just a respiratory virus and children will recover. But 1 in 5 unvaccinated individuals with measles will be hospitalized. 1 in 20 children may develop pneumonia, which is the leading cause of measles-related death. 1 in 10,000 children may develop encephalitis, which is essentially brain swelling, and that can lead to seizures and long-term disability. 1 in 3 of every 1,000 children with measles will die from respiratory or neurologic complications. Measles can also cause what's known as immune amnesia, which basically erases 70% of all of your prior immunity. So children who are post-measles infection have increasing vulnerability to other non-measles infections for about 3 to 5 years after their infection. And then there is a rare fatal neurological disorder called subacute sclerosing panencephalitis that can actually occur years after someone has been infected with measles and is just a terrible way for a child to die. So I do want to discuss the importance of vaccinations. The MMR vaccine is essential, and vaccination is the best way to prevent measles and its complications. The vaccine is safe and effective. We also can use the vaccine for post-exposure prophylaxis if we know that a child has been exposed to the measles virus within 72 hours. Vaccines have saved millions of lives, have reduced infant deaths by 40% over the past 50 years. There may be mild temporary side effects, but serious side effects of vaccination are extremely rare. Immunizations protect individuals and communities, preventing the spread of dangerous infectious diseases. So I would like to present our, actually I would like to bring Dr. Crawford back up to present our next presenter.
That's okay. Thank you, Donna. Thank you very much. Thank you very much. That was wonderful information for us all to have. Our next speaker is Dr. Julie Strebel. Julie is an OB-GYN who practices at Mercy. She's also president-elect of the Oklahoma State Medical Association, and she's also a close friend. Julie, would you please come forward?
Thank you, Dr. Crawford. And thank you, Dr. Tyangu, for all of that information. As we've seen repeatedly, Oklahoma's healthcare organizations are ready to collaborate to ensure our state is informed and healthy. It is a testament not only to our preparedness, but also to the dedication of everyone in the healthcare field who often forego nights, weekends, and holidays to keep their fellow Oklahomans safe. That being said, we can't do it alone. We need your help. The easiest thing most Oklahomans can do to keep themselves, their families, and their neighbors safe from infectious disease is to get immunized. It's just a few shots, and it provides a lifetime of protection. It's also important to remember that some Oklahomans cannot get vaccinated due to significant health reasons, and exemptions are available for those who truly need them, so we need to protect them as well. In times like this, it can be tempting for parents to reach for the computer or smartphone as their primary source of information. However, as a parent myself, I would caution that there's a great deal of misinformation online, especially when it comes to any vaccine and to the measles. Instead, I encourage you to speak to your pediatrician, your family physician, or any other trusted doctor. Thank you to the Oklahoma State Department of Health for their work in keeping the public informed about the measles outbreak and issuing a memo to schools asking them to communicate with families of unimmunized children. This is an essential step in preventing further spread of this very serious and highly contagious disease. Again, I encourage all schools to use this information toolkit. It contains emails, social media graphics, and other resources that can help you reach out to families who may be at risk of contracting the disease. And lastly, as an OB-GYN, I would like to add that unprotected exposure to the measles virus can cause severe complications for pregnant women and their unborn children. It is vital for expectant mothers to make sure that they are protected against this virus as well. Thank you. Dr. Crawford.
Thank you. Thank you very much, Dr. Strebel. While we are concerned about the current outbreak, we are encouraged. The health department has noted a significant uptick in the number of people requesting the MMR vaccine this year. Since January, there has been a 25% increase in the number of MMR immunizations given. We believe this is evidence that parents are monitoring the outbreak, and given factual information and access to immunizations, they are choosing to protect their children, their families, and their neighbors. We hope schools will use the toolkits to conduct that outreach so that more children, as well as the teachers and staff members who work in our schools, are protected. Again, the toolkit is available at the website www.okhealthyfamily.org. There on the lower part of the screen. I hope you will all share it too. Together we can protect more kids and stop the spread of this dangerous disease and other vaccine preventable diseases too. Thank you for joining us today and for sharing in this mission. And we're happy to answer any questions. Since I'll throw out, the first question is, when should a child become immunized? And the first recommended age is that at 12 months of age, they should get their first vaccine. There is a recommendation that everyone get 2 measles, mumps, and rubella MMR vaccines, at least 1 month apart, but traditionally it's given at 1 year and then 4 to 6 years of age. That increases the protection for that child or adult from 92 to 95 to 97%, so that it provides an added point of safety and security for those receiving at least 2 vaccines. Now, should you get an extra one if you don't remember whether you have ever been vaccinated? You can certainly do that. It's safe to get an extra vaccine. Or you can go and get a titer done. Your doctor can order a blood test, and they can see if you have immunity to the measles. So if you have any questions about that, it's certainly something to be aware of for yourself or for others that are in your family. I did want to make a note. One of the things that I wanted to mention was I'm probably the only one in the room, because of my age, who actually had the measles. I am in my early 70s, and around 1957, I was sitting out in front of my house when I felt the first fever. And the funny thing is one of the effects of measles is you get a conjunctivitis or red eye. And the theory at that time is that if you watched TV, you would go blind. And at a 4-year-old who wanted to watch, Saturday morning cartoons, that was tragedy. And so I feared it, and it was spreading around our neighborhood, but we were all told we had to be in a dark room not watching TV because it would cause blindness. Now, obviously, it didn't cause blindness. It made me look funny, but no. But other than that, I did recover, thank goodness. But it is something that we all need to be watchful of, because it can cause a myriad of symptoms and dangerous diseases, in addition to just getting a rash and a fever for several days.
Can you speak to children under the age of 12 months whose parents might be concerned?
Thank you. Dr. Franklin, do you want to speak to that since you haven't had a chance?
I don't need to speak.
Okay. All right. Well, that is a very good point. Dr. Franklin brings up the question, what about children less than 12 months of age who may be exposed because they haven't received, it's not recommended by the FDA nor the CDC to get the measles vaccine before 12 months of age, except if a child is going to be in an area where there's going to be measles spreading. And unfortunately, right now in Oklahoma, that is a concern that's going on. So it is thought that it's appropriate for a child down to around 9 months of age to get the MMR if they're going to be in an area of exposure. Oklahoma, unfortunately, West Texas, certainly, New Mexico is areas of risk, and it would not be inappropriate for the doctor to give an MMR vaccine. That, unfortunately, cannot count as the vaccine that normally is given at 12 months of age. So if a child gets it at 9 months, 10 months, they need to get it again at 12 months, at least 4 weeks between that vaccine given before 12 months of age and one given again at 12 or later months of age. But that will help protect. Now, why not give it before 9 months? We're hopeful, in most cases, it's probably reasonable hope, that the mother was able to transmit immunity to the child, and that immunity lasts for a period of time, and we think it's at least upwards of nearly 9 months that they receive that immunity through being associated with the mother's immunity during that time. Is that correct, Dr. Tayunga?
Yes, we can also give it down to 6 months. But
6 months?
9 months is ideal.
Okay.
Because of what you just mentioned.
Thank you. Yeah, she's corrected me that 9 months is actually, can be given down to 9 months, or 6 months rather than 9 months. So certainly something that can be done in that setting. Any other thoughts from my wonderful panel here that anything else you'd like to add to that? We do want to emphasize that measles is actually not the only vaccine preventable disease that's spreading. It just doesn't spread as rapidly, but pertussis is happening around our country too. Whooping cough is the other name for that. And there is a vaccine for that. It's given to children from 2 months to 4 months and 6 months usually in a combined vaccine. Then it's given again at 5 to 6 years of age, and then again, hopefully at 11 to 12 years of age to protect the child going forward. But adults and grandparents need to consider giving that, because a child less than 6 months of age who hasn't developed full immunity to the pertussis may not yet be fully immune, and that's the most dangerous time for a child to develop whooping cough, because that's where the unfortunate hospitalizations and deaths occur with pertussis more commonly. Anything else?
Immunocompromised?
Oh, Sherry did make that. Dr. Baker, who is a pediatric cardiologist from OU Health Children's, made a point earlier to me that she has to work with all kinds of children who have survived. They've done a fabulous job of helping children survive congenital heart disease and are otherwise immunocompromised from a variety of reasons. And if they get the measles, they're at grave risk of developing the complications, including death. So that's another place where not only vaccines that they receive, but the vaccines of those around them protect those children who may not be able to develop an adequate immune response. And that's other children too who have had cancer, who've had, for some reason, other types of therapy that suppress their immune system. They may not be able to mount an appropriate immune response to the vaccine, and therefore they're at even graver risk. So there are people that live around them, the people that they go to school with, the people they play with in the playground need to protect them. That means protecting their neighbors. Sorry? Thank you. So with that, any other questions? I don't see any hands up, so I want to thank the Oklahoma State Medical Association, OU Health Children's, the my own organization, the Oklahoma Alliance for Healthy Families, and all of our partners from the Hospital Association and the Oklahoma Academy of Family Physicians for being with us today to help us promote this very vital and important advocacy for our children and our state. Thank you very much. Yay. Thank you all. Yeah. High five. I slipped in there. I slipped in.